Hi markers, I thought I'd make a quick video just to outline the marking guide to you and give you two examples of students' submissions and how you can potentially approach those. So this will just be for the concept map only though. Okay, so for the first criterion of the concept map, this is in reference to the risk factors, and so this is a total marks of 6. There are 3 risk factors that the students need, so each risk factor that's done correctly would be 2 marks. Now how those marks are allocated, if they identify the correct risk factor, they get half a mark, and if they link an accurate explanation or mechanism for each risk factor, that's 1.5, which totals 2 marks. Three risk factors, that's 6 marks. Now what we're looking for in terms of risk factor would be older age. Ensure that they actually say older age or elderly or something about older age, not just age. The link here is could actually go to the etiology, so it could go to the UTI, which is to do with a reduced immune system response, or it could actually increase the risk of sepsis, which is usually through delayed symptoms picked up later, therefore the progression's increased. The second one is catheterization. Again, this could link straight to the etiology, which is the UTI, and that's due to the direct path into the bladder, or could actually increase the risk of sepsis itself. It's been shown that catheterization actually causes injury to the urinary tract, which then allows the bacteria to get straight into the blood, which increases the sepsis risk. Or the third final risk factor could be recent surgery, or is recent surgery, and this is around the sepsis risk. Now, you may get some students that list urinary retention as a risk factor. That's not the strongest, so I wouldn't give them full marks there, but we can accept that, but it's just not going to be as strong as these 3. In terms of criterion 2, so this is a total of 3 marks. This is kind of the stem or the main skeleton of the concept map. So this is how it goes from the etiology to the broad process of sepsis. So what we're kind of looking for here is from the UTI, which is the etiology, the bacteria then starts to initiate inflammation in the urinary tract epithelium or the uroepithelial cells. This breaks down that barrier, and then they can start to get access, so the bacteria can get into the blood, or at least their toxins can get into the blood. From there, the immune system is activated. The immune system then overreacts or reacts excessively with their chemical mediators, etc., causing vascular responses, and that can then lead to those downstream effects. Moving to the last part of the concept map, which is criterion 3. This is for the clinical manifestations. This is marked out of 10. There are 5 clinical manifestations that the student need to identify, so that means 2 marks for each one of those 5, gives them the 10. To get the marks, they have to identify the correct one, which is half a mark, and then again, a correct mechanism is 1.5, totaling 2. What we need to look for are fever rigors, so that should be the same. If they list them separately, you only give them the 1 for that. Confusion, disorientation, again, that is the same clinical manifestation, so if students list these as 2 separate ones, they get the mark for only 1. Low blood pressure, or a blood pressure of 85/50, again, that's only the 1. Cold and clammy mottled skin, again, that can be only the 1. If students try to do cold, clammy, and then mottled as separate, you only give them the 1. And then finally, tachypnea, or respiratory rate of 32 and above, being rapid and shallow, again, that's only the 1. Some of the reasons for that, the fever rigors is really more around the immune system activating cytokines, which then goes to the hypothalamus. That's kind of what we're looking for. They may demonstrate the rigors part, that's just the activation of the muscles shivering, but that should be included in a similar pathway. Confusion, disorientation, most likely comes from the low blood circulation or blood volume, therefore a reduced blood pressure, therefore reduced cerebral perfusion, leading to confusion. Or they could also talk about the inflammatory response, which then goes into the brain, causing effect to glial cells, neuronal cells, which leads to the confusion. Low blood pressure, that comes about from the vasodilation, the increased vascular permeability, reducing blood circulation, total blood volume, reduced central pressure, reduced stroke volume, reduced central pressure, and then low blood pressure, or they may go to the effect on the heart, so the cytokines impact cardiac contractility, decrease in stroke volume, decrease cardiac output, decrease in central blood pressure. In terms of cold, clammy, mottled skin, that's just due to the vasoconstriction in the periphery and the skin, therefore leading to that effect. Or they may also talk about the activation of the sympathetic nervous system leading to that clammy skin that we see in a stress response. Lastly, with tachypnea, there could be a few explanations here. There could be the impact from tissue hypoxia leading to anaerobic respiration, increased lactate, decrease pH, acidosis. Respiratory center tries to compensate to blow off the CO2. So that's one way. Another way is through cytokines impacting the respiratory center, so that's centrally in the brain, or finally just the activation of the sympathetic nervous system in response to potentially the low blood pressure. And as we know, if you activate the sympathetic nervous system, you'll not only get an increase in blood pressure, but a respiratory rate as well. So that is the marking guide, so hopefully that makes sense. Now what I'll do is I'll quickly just go through a couple of draft submissions of students just so you can see how a map potentially will look. So here we've got the risk factors in blue, so we've got tick, recent surgery, tick, old age, tick, urinary catheter. So they'll get half a mark each for those. Have they attempted correctly? So we've got the surgery triggering the stress response, immune suppression. Yep, I'm okay with that. Old age, weakened immune system. Maybe just flesh that out a little bit more. So maybe not quite full marks, but they've done pretty well there. And the urinary tract, the catheter, direct route for the bacteria straight into the etiology. So that's good. So they've done pretty well there. Looking into criterion 2, they've gone from the etiology, activating the immune system, excessive immune response, cytokines, which is good, reduction in mitochondria, good, hypoxia, leading into they're kind of gone into septic shock, which we don't really need to, but this process for criterion 2 is good, so I'd pretty much give them full marks for that one. And then finally we go to clinical manifestations. So they've got tick, the cold, clammy, mottled skin, tachypnea, confused disorientation tick, hypertension tick, fever, rigors tick. So they get the half marks for all those 5. And then let's have a look at their mechanism. We've got the local immune, triggering the immune response, go to the hypothalamus. Yeah, not quite. So I'll probably give them 1 out of 1.5 for that. So not quite. We just wanted to see what the hypothalamus is doing, why it's resetting it, and therefore why we're getting, if they're talking about the rigors, how is it generating those contractions. Pretty good, not quite full marks. Go into this one here, blood tone changes, decreased blood volume, decreased blood pressure, hypertension, happy with that. Go into the confusion, inflammatory mediators go to the blood-brain barrier, that's fine. Toxins go into causing neuroinflammation, good. This one here doesn't marry as well to this. This one here marries better to up above, so this would actually fit better after decreased blood pressure, therefore hypertension. What we'd probably want to see following the toxin is just the change in neuronal function, which then causes confusion. Again, they've done pretty well, just not quite full marks, probably just half mark less or 2. Then coming across here, we've got lactic acid buildup, chemoreceptor. Yep, that's good, so full 2 marks there. And then finally, we've got the blood being diverted away, blood restriction, vasoconstriction in the skin, good, and lack of blood flow to the, yeah, happy with that. So they've done really well. This is a good concept map. So this is a good indication of what a good concept map will look like. Not quite the full marks, just probably lost half mark here and there. Moving to another one. So this is not so good. So this gives you a good indication for students not following instructions. So they're being told clearly that they need to have everything on one slide. What you can see here is it goes over 2 slides. So what I would do is I would assume that this is not there because it's not on the slide, so I only mark what's on that slide. Students have been told that they need to submit in a PDF. Sometimes if they submit with a Word document, the formatting gets impacted. So this is unfortunately the student's responsibility. So if I was to mark this, I would pretend that this hasn't been included. So we don't have any risk factors here, so I wouldn't give them any marks for risk factors because there's no indication that risk factors are on the map. And I would put a comment there to say risk factors aren't included on the map, and they need to be aware of that. So that would be criterion 1. Criterion 2 is the pathophysiology. So we've got urinary tract. That should be urinary tract infection, so I'd put a note there. Bacteria enter the urinary tract, bacteria replicate. E. coli, there's no indication E. coli is responsible, so I'd put a comment here. Bacteria enter bloodstream, bacteremia, systemic inflammatory system triggered. Again, they haven't orientated this well into the box, so I wouldn't give them the full marks for that as a box, just because I can't read it all. Cytokines, white blood cells, help it. So it's not great. So out of the 3 marks, I'd probably be looking at about a 1 for that. Not well done. Now go into the clinical manifestations. Got confusion, that's okay. Cold, clammy skin, that's okay. Hypertension's okay. Fever, rigors, okay. So they get their full marks 1, 2, 3, 4, 5, half marks each for those. Let's have a look at the processes. We've got the systemic inflammatory system triggered. There's no indication why the person would get metabolic acidosis out of those steps. They needed to be talking a few more things about no oxygen delivery, therefore anaerobic respiration, therefore lactate production if they want to go down that path. So they're not going to score well there. Bacteremia straight into fever, no speak of the cytokines, no speak about the hypothalamus, so no real marks for mechanism there. Going through here, we go to hypertension, but again, no really talking about how it's changing the blood volume or the distribution. It's just going straight to hypertension. Less skin, not sure what that means, and brain hyperperfusion, altered mental status confusion. A little bit better, but not full marks. So you can see with this map compared to the first one, the student's not going to score very well. This also gives us a good example of where a student hasn't taken the time and effort to ensure everything's aligned well. So I know this is a draft submission, but you will get some students that are careless with their formatting. And so, as I said, if they are running over multiple slides, you just pretend that that's not there, okay, and just mark what's on the main slide. All right, there we go. That's the concept map, both the marking guide and also 2 examples of students' assignments. So in your email that you've received, you now have the student's assignment and the rubric. You have the marking guide and you have the quick comments and this video. Hopefully that will help you with your preparation for the marking. Before we actually start our marking, I'll get you to mark 3 assignments. I'll send you those closer to the due date so you can work with your moderator on ensuring your 3 papers have been moderated and you're right to go with your allocated number. And just remember also we need to have an audio comment included in your marking. So with your marking, you're going to put comments within here. So you're going to put comments. I'll just show you quickly. You can put a comment in here and write something about what was good or what was not so good. You can put your quick mark comments that I sent through in that document into the rubric section. You obviously mark off the rubric section, and then at the end of the assignment, you put an overall audio comment, which is about 1 minute in duration, but that just gives the student a more personalized bit of feedback that indicates how they performed overall. All right, Marcus, thank you so much. I'll be in touch shortly.